Hey y'all, I need for you to do me a favor. I need for you to clear the ears out and listen to me because I've got something very important to say. No, you're not crazy. No, you're not just imagining it. And no, you're definitely not alone in it. It's something that's kind of a phenomenon that's coming on in a lot of doctors' offices, not just specialist offices, but it's something that can have and is having a big impact on the invisible community. What is it? It's the one issue per visit policy that so many doctors and clinics are using now. Let's get into it tonight on Invisible No More. Hey, y'all. Thank you again for coming by for a Thursday night for Invisible No More here on the Eclipse Pain Network. My name is Keith Johnson, and I am your host once again for this Thursday night. And if you're returning, thank you for coming back. If you're new here, what is Invisible No More? Well, simply put, it's the safest place on the internet if you're dealing with a chronic illness or a chronic diagnosis, something ranging from chronic illness to chronic pain to mental health struggles. Whatever's wrong with you can't be seen, hence it's invisible, which causes family members, friends, circles, work, society, doctors to often have problems accepting really what's going on with this. So here we don't med shame, here we don't treatment shame, here we just give love, support, and we talk to each other and we share stories, ideas, techniques, and we bring up topics that are happening and are important to the community. Tonight's topic would be the one issue per visit policy that so many clinics and so many doctors' offices are doing right now. And some doctors don't advertise it. Some clinics don't even advertise it, but some do. I'm going to put up a graphic here. This is from a place called the Total Care Specialist here in the DFW area. This is on their website. You can read along here. Based on insurance reimbursement policies, we can only address one issue per visit. We'll address your most pressing concern and then follow up at your follow-up visits, address what may be pressing next. So you go to this clinic and you're dealing with chronic pain, but you've got like neuropathy in your thighs and you have radiculopathy in your chest. Doctor's going to be like, well, which one's worse? We're going to go there first. Even worse if you're dealing with something like POTS, where you have multiple symptoms stacked up, really are the definition of POTS. Or if you're dealing with fibromyalgia, they want you to pick one issue where your issue is all these things combined, right? I mean, so think about it. The system's forcing complex patients, 99% of the invisible community, to chop our health into separate billing-friendly episodes. If your body doesn't play by the rules, then we often get left out in the cold. And again, that's kind of the problem, because for lots of us, what's wrong with this isn't just one symptom. It's a multiple, and those multiples stack up on top of each other. And so why is this happening? Well, it's because of the corporate model of healthcare in the United States, right? Where doctors are pretty much forced into 10 to 15 minute meetings, I don't know what you want to call it, sessions with patients, where the billing, right? Insurance companies aren't paying as much, so doctors have to see more patients. And what is also, insurance is also doing as well, by forcing just 10 to 15 minute appointments, is they're only paying for one cause for that visit. So if your doctor's only going to get paid for, say, my neuropathy in my thighs, and he's not going to get paid for the radiculopathy in my chest, he's going to want me to come back for a second appointment soon so we can talk about the radiculopathy. So the insurance company gets to bill twice. And so they're billing, the doctor's billing them, then your copays go up, everything goes up. It's all about money. They want the brief meetings, and then they want, it's just the separate billing codes is really what's going on. And, there's some data that's coming up, on this basically fee-for-service type insurance mode that we're stuck in. There's a study that came out based on some clinics here in Texas, clinic encounters here in Texas, where they found that complex patients tend to arrive, I want to get this right, tend to arrive with an average of 5.4 concerns per visit. But you only get one. So that's 4.5 more office visits you're going to have to go to if you're dealing with POTS, or if you're dealing with fibro, or if you're dealing with another complex diagnosis, because they're only going to let you do one. And again, so what are some of the dangers of this? Number one, I can guarantee you, your doctor is not a fan of this. At least the doctors I've talked to. In fact, we can go back to some of the podcasts that Dr. Leak and I have done, and he hates the fact that it's a 10-minute session, right? He hates that because it takes more than that, because the whole idea to have an individualized care plan is to treat the entire patient, not just one symptom. But then it gets to where, again, if you have POTS or EDS or fibro, you know, your joint pain and your racing heart technically really aren't separate. They're part of the same condition that you're fighting, right? And so you're being forced, your doctor's being forced to address the heart, and then come back next week and we'll talk about the joint pain, or come back next week and we'll talk about this, or we'll talk about that, instead of taking the opportunity to get it all done at one time. And then as patients, it's a cost to us, because it's like a frequent flyer tax that gets imposed on us. Because if we go in for my neuropathy, I have to go back next week, and that's a separate copay. That's an additional $50. So I'm at $100 to get my doctor's visit covered instead of the $50. But insurance doesn't really care, do they? So it's not just a wallet thing. To me, it's a health situation. It's a danger issue, because patients aren't getting the care they need to address what's going on with their bodies. So as patients, what do we do? How do we address it if we go to the website to this new provider and we see on their website, like that one clinic, that we can only address one issue? What do we do? A couple of things off the top of my head. The first thing I would do is, instead of coming in and saying, I've got I have this condition, which is causing issues with my skin, it's causing issues with my heart rate, it's causing me pain, it's causing issues in my joints. Maybe describe it as, I'm having this massive flare that is really impacting my joints, my skin, my heart rate. Present it as your condition for going is your flare, not your increased heart rate, not your joint issues. Second, we just talked with Evie, just the other week, right? Evie is a medical assistant. And one of the biggest things we tried to get across during that interview with Evie is, your medical assistant is your key to getting good care, or they can be your key to getting good care. It's your opportunity to get out right there in the very beginning. Why are you there? Again, you can address this flare you're having just like you would present it to your doctor, or give them 3 things that are all tied together. That would be another one, or just tell the MA or tell the doc, hey, these 3 things are all connected. I noticed it started happening after this. What can we do? And again, that will help the doctor bring up, or give him time, or give him pause to look at the separate things that are combined together that are causing that flare for you. Because if as complex patients, as invisibles, we average 5.4 issues per visit, and they're wanting us to break it down to 5.4 visits to get all of our issues straight, it is going to push out any diagnosis. It's going to push out any quality care we can get. So we need to start developing and thinking of ways that we can defeat this system. So leave me some comments about what you have tried, or what works for you, or what hasn't worked for you, so other people can try what you've suggested. That's what Invisible does, right? It doesn't matter your diagnosis. It could be EDS, and I could be dealing with neuropathy, but I can learn from them, just like you can learn from somebody who deals with CRPS, and you're fighting some mental health struggles. We learn from each other because we love each other, and the whole key to all of this is for us trying to find ways to be at least a little bit better. I love you guys. Thank you for joining tonight. We will see you next week. Until then, I hope tomorrow is a better day for you. I hope tomorrow you find the victories that you so deserve. Until next time, y'all, be safe. We'll see you. Peace.